welcome back.
Yep. This is our third and we promise the final segment of this video. Okay.
And we were talking, more about how important it is to get to know clients very specifically and what they're like. And what I was going to say also is like the benefit of working with this population is you get to know people over a long period of time. So it's not just little segments and for a few months of their life. Sometimes you can work with people for years. You really get to know early symptoms and know what they're like and be able to talk with them, which is very gratifying as a professional.
Yeah, I think that speaks to the fact that there's sort of a community of people who tend to work with people with schizophrenia. And if the clients, when they're out of the hospital, which is the majority of their life, say in Santa Barbara County, there may be 4 or 5 or 6 different programs, Sanctuary House, Phoenix House, Path Point, Mental Health Association, but the clients require ongoing services most often due to that persistent nature. So you could maybe work with them at one of the agencies, and 2 or 3 or 4 years later, you may get a job at another agency, and the client will then be in one of the programs at that second agency, or you might get a job as Louise was a case manager in the county, and then track them and work with them ongoing. So yeah, like that long-term historical knowledge of the client seems to be really helpful. Right. Have you ever found a situation that really came into play? Because I'm just thinking of one, that just reminded me. Do you want to hear mine?
Yeah,
real quick. Well, I found like that many clients, when they relapse and their symptoms start getting really florid and really active again, there's always that question, what has happened in their life that's maybe feeding into that? You always think, okay, well, maybe there's been a medication change, because so many people with schizophrenia are on antipsychotic medication. But beyond that, having ruled that out, it's that knowledge of knowing the client for such a long period of time that really, oftentimes you could pinpoint a stressor, be it a relationship with a friend or a roommate, or certain things that seem really mysterious. I had one client who would become, on the catatonic side, just freeze, and her eyes were tracking non-discernible stimuli, as it's called. And that would happen probably once every 6 months to a year. And what we realized, and the knowledge became that she relapsed psychiatrically when she had urinary tract infections. You know what I'm saying? The urinary tract infection didn't cause the schizophrenia, but what happened is the internal pain of the infection, the stress of that for whatever reason, would just cause her to kind of like exit her more engagement with the world and go into what was considered more of a psychotic state.
Yeah.
So,
and people, often don't have the verbal skills and to give you that information. So you have to become this observer, and you have to know what specifically to ask.
Yeah, so true. It's not like that our clients are of low IQ. People with schizophrenia in general are above average IQ, but there's just some loss in executive functioning ability to like execute and problem solve. So yeah, I mean, I've had also one clients relapse just because it turned out their washing machine was broken, and it took, and there was all this time that was where they were relapsing, and before we figured out it was a broken washing machine. So you've had things like that, right? That's just, it's a problem that could really be solved.
Right, they're sometimes very easily solvable problems. Or they're in a different environment. They've moved to another apartment, and we have had lots of examples of people who've moved into a different place and seem to have lost their skills of cooking and cleaning and taking care of themselves. But really, they just are not oriented to where they are, and nobody thought to teach them how to use a gas stove instead of an electric stove, or thinking about one who, got lost real quickly and didn't know the neighborhood, and nobody had thought to teach her where things were in the neighborhood. I mean, we pick people up and put them in a new place. There's all kinds of, you think how stressful it is moving, there's all kinds of stresses related to being in a different place that you're not familiar, that can really trigger a lot of anxiety.
And that often results in a relapse of psychotic symptoms.
And people's habits and routines, they benefit from having very good routines of when they take their medications and sleep and wake cycles, those kind of things. So when those are disruptive, the whole system can get kind of out of whack.
Yeah. So let's see. You were asking.
Oh, I was gonna in terms of like skills of work that clients can learn. I saw so much of this when I first started working with Bob. He was working with UCLA and doing research programs in Santa Barbara County, and had been working in some state-of-the-art programs doing skills training. And it was so fascinating because if you start looking at the whole area of rehabilitation, there's so much that can be learned, and there's so much positive. And I wanted to just ask you a little bit about that after, lots and lots of years of working with clients in sort of a rehabilitation skills approach. What kind of things did you learn about what clients can achieve?
Well, I have to say the one thing that I learned, which I think is the most profound learning, is that clients with the most serious mental illnesses, serious schizophrenia, where it appears like they're attending at a very low percentage of time outside their sensorium, so to speak, their own perception, still have the ability to learn. Clients who are very ill can still learn, and often still have goals. Combination, they have goals and they could still learn. And that's the number one learning is that people with the most serious mental illnesses, and I think we discovered this at UCLA, still had the ability to learn if the teaching was provided in technology that really worked. We don't have time to talk about it now, but we kind of developed something called errorless learning, where in the process of learning, rather than having the client commit errors and learn by trial and error, if they could learn in minimizing the errors, it causes a lot more clarity in the learning, and people learn better, and it's more durable. But that's the main thing, is that clients can learn. So what can they learn? We're talking clients who are quite distracted and preoccupied. They could learn to identify the warning signs of relapse and catch that and monitor that. And that's one of the first things we taught them. They could learn to have friendly conversations, not necessarily therapeutic, but to learn how to have conversations about things that are happening in the world, Academy Awards, movies, things like that.
Things to talk about with their families, so that really normalizes the family relationships. That they go home for the holidays and talk about normal things.
Yep. Clients can learn to be better. You could teach them problem-solving techniques, and they could learn to become much better problem solvers. Another thing they could learn is they could learn to manage their medications, which is crucial if a client is going to get out of any kind of more institutional setting. They could learn to manage their medications and also learn to assert their needs with their physicians.
Right.
And one thing, and what really helps that learning is a trainer, coach, therapist, but also peer-to-peer role models. Peer-to-peer role models is really good in that. We learned all that at UCLA, that clients who many people had written off and thought they just needed to be maintained had the ability to learn and could demonstrate it.
They can learn the skills, and they can work, which is another thing that's not really shown in the book so much. Most clients want to learn, want to go back to work, want to have productive, useful things they're doing during the course of the day. And so as their coach, as their ally, they can learn those skills, which is, very motivating to them.
Sorry, you guys.
They often want to have dogs.
That's true, they do. Our dog just came up and decided to interrupt us, so might as well put him up here. We can't fight it.
Right.
Yeah, it's Poochie. So, yes. So
that going into working with clients with an understanding that yes, they can learn. Yes, they can learn the skills they need. They can manage in the community if they're helped to learn those skills. What I was also amazed at is that we would refer clients to UCLA, these groups where they would learn in a sort of a classroom setting about their symptoms and learning skills, how to manage that. The clients not only learned, but they liked learning. They had like an incredibly high participation rate with these clients, which we didn't think could be done. You think you have to drag a client to go to a group and that they hate it. Guess what? They really liked it. If it was a class in a classroom setting that was teaching them things they really needed to know how to do, and that they could immediately get benefit from, they wanted to go. They not only learned, but they liked it, and they felt they felt like intrinsically rewarded for having graduating those programs.
Yeah. Many of the clients have been therapized a lot, even in the old state hospital days and just in general. But when they could learn skills that are relevant to them, like you're saying, Louise, they will engage at a level that's extremely more intense, having run so many therapy groups versus like skills training groups.
And if they have a reason to manage their symptoms, they will. So if you're offering to help them, get into a work site, they may be hearing voices constantly, but they will learn how to try and manage that in order to be able to get to that job. That is very helpful. It's amazing what people will manage and put up with in order to get a better life. And you have to really commend how courageous and strong-willed people are to be able to learn how to and try to shut out those voices and shut out those confusing thoughts in order to get done things that really help them in their lives.
Well, yeah, that's a great example. So I think with that we've shared a lot of our experiences really quickly, and we hope you enjoyed this. And hopefully there's some insight and pearls of wisdom that you could glean from the stuff we've talked about.
Right.
So with that, we say goodbye, and Poochie says goodbye too. Bye, Poochie.